When hiking outdoor, you could encounter a lot of allergy. The most important one, since outdoor, is all the pollen, so the trees, the grasses, the ragweed, the weed will be there. Also, you're going to have some mold, of course. Also, you're going to have all the insects. Allergy are substances that ordinary normal people do not react to them. Patients who have allergy react to these normal substances in a very severe way. And usually patient will have genetic predisposition to them. And when they're exposed to these substances, usually called antigen, will cause an allergic reaction. If the allergic reaction is caused in the nose, it causes allergic rhinitis. If it's in the chest, we call it bronchial asthma. If it's in the skin, we call it eczema or urticaria. When you do the skin test, then you could tell the patient what they are allergic to and how to avoid it, and of course you could go over treatment. Skin tests for pollen, dog, cat, mold, dust mite usually start with prick testing. Put on the patient's skin with a prick the antigen that you want to test for. If you want to test for dust, you'll have the dust mite antigen there. If you want to test for dog, you do for the dog, etc. And then you have to have a positive control and negative control among the skin test, so you know what you're allergic to. When you skin test a patient, if they have an allergic reaction to certain antigen, which is a substance you're allergic to, it will be like a mosquito bite. It will be swollen, it will be red, it will be itchy, and then when you compare it to the histamine control versus the negative control, you could tell from the size of the reaction how big it is and how important it is. If you have an anaphylactic reaction to bee sting, wasp, etc., you must carry your EpiPen with you. And you should carry at least 2 EpiPen because each one lasts about 20 minutes, so 2 will give you enough time to seek emergency help. If you suffer from asthma and you are hiking, you must carry your inhaler with you. Could you tell by just looking at the patient without examining them if they have allergy or not? Most likely, you could do that if the patient have what we call the transverse nasal crease, is a bridge over the bridge of their nose, a line. It takes 2 years of doing this, the allergic salute, in order to get that line. That line is very white in the summer where the rest of the skin is so dark, and you could just walk to any person, if they have it, you could tell they have allergy. Also, they have allergic shiner, usually under the eye, and they have bag, they have line, and that is from all the nasal congestion. Patient who will sit in my office trying to scratch inside the turbinate by wiggling their nose or their mouth, these are very specific signs and symptoms that you could see in a patient who have allergy. Are you born with allergy or do you develop them through your life cycle? You have to have genetic predisposition and you have to have the environment, the exposure, and both of them will lead to allergy. If your mom or dad, one of your parents have allergy, your chances of having allergy is 33%. If both parents have allergy, your chances are almost 68%. In the United States, most studies stated that at least 35% of population will have allergy in one form or another, and some study would go up to 50%. How do you prevent being exposed to certain allergens? And this is a very good question, and I think it's very important to educate the patient that if you're allergic to pollen, I usually tell the patient, I can't tell you don't go outside where the pollen are, but I could tell the outside. That means the pollen not coming inside. How do you do that? You close the window, close the door, use the air condition. Don't dry clothes outside, because if you do, you bring all the pollen back in. You should take a shower before you go to bed, so you eliminate and remove all the pollen from your hair before you go to bed. And if somebody cut in the grass, you stay indoors for 20 minutes. If you are in the car, the window must be up and you should use the air condition. When you go to your family doctor or your allergist and they tested you and you know what you're allergic to. And the most important is prevention, because prevention have no side effect at all. If you still have a lot of symptoms, they're gonna give you some medication.